Live.
Welcome to the COVID313 Coalition for Families and Students. I'm Christine Bell, and this is Emerson. I've told you every week I'm a mom, and today I have all three kids with me, so you might see them pop into the screen. But this is Emerson. She's 3 years old. She's eating some lunch. She wants to know from all of you, do you like carrots? And so drop that in the chat because we've got people waiting to hear from you. You can put whether you like carrots or not for lunch in the chat, and make sure that our moderators, we have one moderator today, Marty. We have the super moderator. Marty is waiting to hear from you. So you can, yep, you can put those, so you can put that, the answer to that question in the chat. We've got a great show for you today. And like always, we're translating the town hall to Spanish and ASL. So we want to give folks time to get on the right line and get comfortable. Ophelia, please give us the details on how to listen to Spanish interpretation.
I will, thank you. Muchas gracias, buenas tardes. Si quieren ver este video en español, por favor, busca en el chat Detroit Hispanic Development Corporation. Puedes ir a nuestra página de Facebook, Detroit Hispanic Development Corporation, y ahí vamos a estar transmitiendo en vivo lo de español.
Thank you so much, Ophelia. It's great to have you here. And we've got Katie here as well. Katie, can you please share the instructions for ASL interpretation?
Thanks, Katie, and thank you, Ophelia. And hello, everyone, and a special hello for Christine Bell's co-moderators. And I love carrots. So my name is Jametta Lilly, and I serve as the CEO of the Detroit Parent Network. I am a proud member of this coalition. I'm a Detroiter, I'm a mom, and I'm a proud nana of 2 awesome and several grandchildren. And I hope that they are watching so that they know that carrots and broccoli and asparagus and green beans and all those things help keep us healthy and powerful. So we want to make sure that as you are tuning in, and particularly to our experts that will join us today, to please speak slowly enough so that our awesome interpreters, both Katie as well as Ophelia, can capture your information and capture it correctly. We are also going to ask you to please keep an eye on your chat. Terry Whitfield, who is our phenomenal timekeeper, will let you know when you're almost there for your time being up. And if you go over a little bit too much, either Christine or I will come on to the screen and smile very nicely and say, we need to wrap up. Not because you're not important and what you're saying is awesome, but because we have other really important information along with yours to share. So as I've indicated, we have some really important topics to cover today. We are absolutely needing to hear from our pediatricians and our health department. We are still very much in the midst of this pandemic. And in fact, we have some new risks and threats to our health that we need to have some discussions about. We're also looking forward to hearing from Tony Paris from Sugar Law, because the reality is that for many of you, your unemployment might be up, or what are the new regulations and benefits of that? But as we think about the pandemic and we think about employment, is also the question of mandates for vaccines. We'll have that kind of conversation as we move forward. So please make sure that you're comfortable, be thinking about the questions that you may need to ask, and we'll get ready to start the program. So I want to first bring in one of our other co-moderators, and that is going to be Rajeshri Bhatia, who will join me a little bit because we are going to have Rajeshri as well as Dr. Cunningham and as well as one of our DPN parents that was with us the last time to talk about her story and ask questions of our pediatrician about back to school. Rajeshri?
Hi, everybody. Welcome. It's good to see you all.
If I can have, sorry, I'm on my phone today because we are without Wi-Fi. So I'm just trying to get myself caught up here. So if we could get Dr. Cunningham, you want to unmask, I should say, yourself, or have your camera on, that would be great. And then I know Miss Latonya, you're here to ask some questions. So why don't I let you go ahead and get started?
Good afternoon, everyone. Excuse me. I lost power too, but I am here. My name is Latonya Peterson. I am a mother of 4 wonderful children, ages 24, 22, 18, and 16. And I have 2 wonderful grandchildren. I'm also a parent program assistant for Detroit Parent Network. And I also facilitate Love and Logic, which is a parenting class. Without further ado, my first question is, hold one moment, because I have this. I had to shift some things around to work with me.
And Latonya, this is Jametta. Would you just
Yes,
take
ma'am.
a moment and share with us your own story about how you had to kind of work through some things yourself, the questions that you had about the vaccine and what's happened with you and your family over the last few months? If you could take a few moments and share that, that'd be great.
Okay. I had a few family members to pass away of COVID, and I was real concerned about the vaccine because I was misinformed about how the vaccine worked before I even agreed to take the vaccine. However, it was at a Detroit Parent Network event with the health advocates that we have. They gave me correct information, which was great, because I don't think I would have took it all this time if it would have been for them providing the correct information. However, they explained to me, the pros and the cons, and the cons was very minimal. So I ended up getting my first and second dose at Detroit Parent Network, and I clowned. I'm telling y'all the truth. The first time I clowned a lot, and I threw a hissy fit. But I got that vaccine, and because my schedule was kind of complicated, it was Detroit Health Department. They offer service where they come to your home and vaccinate for free. So just maybe a week or two ago, I got my whole family vaccinated at one time. So we didn't have to miss no work. Of course, they didn't have to miss their events or nothing like that. And it ended up my family not having no side effects. And I even encouraged my parents to get the vaccine. So not only is my immediate family fully vaccinated, well, they will be fully vaccinated on the 23rd. Not only is they vaccinated, but my whole family is vaccinated, which I'm proud of. But it's due to the fact of the programs that Detroit Parent Network partner with and that they put on. So I think that's very important as well. So that's just a little bit of my feel about it. And my first question for the my first question.
Rajeshri, you're on mute.
Sorry about that. Latonya, I'm sorry. If you could give us a moment. It looks like Dr. Cunningham is running a few minutes late. So if you could save your questions, you and I will come back on in a few minutes. Ms. Jametta, why don't we go ahead and jump to Nurse Hackney, who's on, and you can go ahead and do that segment and then come back to us and we can do this one. Thanks.
I certainly will. And again, it's always a joy to have our Detroit Health Department. Tanea, could you come on screen, please? And it is always good to see you in this space and quite frankly, in this war, right? Of stopping COVID and making sure that our community is safe.
Yes.
Go ahead.
So we can get examples like Ms. Peterson. I'm glad that you all had that event so we could be able to be there to educate and give the right information. That's so exciting that the Detroit Health Department, we're seeing results from the homebound program and just being ready and available for the community.
And we really can't emphasize this enough, that it has to be all types of players. So
Yes.
the Detroit Health Department, your business is health. Detroit Parent Network, ours is to love, support, empower parents. So we reached out and partnered with you, the Detroit Health Department. Wayne Health, their mobile unit was actually the unit that was on site to provide this information on an ongoing basis in our community navigators. So it's taking all voices to work together to get us to where we are.
Yes.
And speaking of voices, so we are now in, we know really clearly, no way out of the woods with this COVID, and it is morphing. But we really have some real questions about, now that people are returning to work, organizations as well as schools are seeing a number of things, and we really need the help of our local health department with this.
Yes.
Can you talk about what is the role of the city in providing guidance to businesses, schools, and organizations as we are all trying to cope with what to do as we think about reopening, or if we have reopened, particularly in the context of this Delta variant?
As far as businesses and workplace environments, I'd like to start off with sharing data. I do have a few slides because we do have some new updated guidelines right now.
Right.
And that might answer some of our questions.
Good, go for it.
So I'm going to go ahead and share my screen and give our updated information. Disabled. So I think I need a sharing screen.
Molly, can we do a share screen here?
And this information will include.
Yes, let me open the screen.
Okay, this information will, I'll give some information as far as working with Detroit DPS CD right now. We're helping build guidelines. Right now, we're working and meeting with them for schools, like we mentioned last week, so we can return back to school safely. What it looks like for our parents, for our students, and the staff.
Great, you can share your screen now.
Awesome. Okay, I'm going to share this screen here. And of course, we're going to start off with some numbers. And you all see my screen there?
Mm-hmm.
Awesome. So as of yesterday, come on screen. Our numbers as of Detroit yesterday, we're still over 52,000 confirmed cases, over 2,300 deaths. If we look at the numbers on the right side, we're looking at the positivity rates. So our positivity rates have changed. St. Clair is at 5.8. All of these have gone up. Washtenaw just went up maybe 1%. I mean, it was at not even 1%. It was 3.2. So they were, I think, at 3.1. But otherwise, Monroe, Wayne, Oakland, Macomb, all have gone up. Detroit City, we have definitely gone up to 6.1. The whole Michigan in its entirety is 6.2. So where are we right now as far as who's been vaccinated? At least in Detroit, we have gone up 1 point. We're grateful for that because that means there's 1 point less of Detroit that has to worry about serious illness and death from having COVID. So 41.1 right now of the city of Detroit has received at least 1 dose of a vaccine, COVID vaccine. Macomb County, Oakland County, Outer Wayne, Washtenaw, numbers are superb. We have to get there for the city of Detroit. State of Michigan in the entirety is 58.9. If you look at the middle future doses schedule, we have over 1,200. That number has gone up, and I'm sure it's because of the threat of the Delta variant and also trying to get out to the community and having events like this to give out the right information. So we do want to increase this number for future doses. People do not have to schedule to go up to the vaccine site and take your vaccine. We'll talk about that a little later, but the variants, this is the most important other thing to stress about right now, because the variants we're most concerned, and what we're seeing, Delta is over 83.4% of all positivity of COVID. So Delta, and we have one under that's coming up, which is called Lambda, but Delta right now is more contagious. It's attacking our younger population, 50 and below. And it's a concern. It's more transmittable. It's transmittable to those that are vaccinated, that can get it and can pass it to those that are unvaccinated. And what does that do? It just keeps the cycle going if we're not vaccinated. It keeps us sick. It keeps Detroit sick, and we don't want that at all. So our next thing is, what does the community do? Get vaccinated. Because right now our numbers are climbing. Last week when we met, we were moderate. Now we're severe. We're red right now in the city of Detroit and Wayne County. Are the vaccines effective? Yes. Just because a person is positive being vaccinated, they're not severely ill, they're not having, they're not dying from it. The thing is, you get vaccinated, you don't severely get sick, you don't go to the hospital, you don't have to lose another person, or you don't. So that's what we want to prevent. That's the most thing. Yeah, you can get it, but you may not have those symptoms. So the updated COVID-19 guidance for the city of Detroit as of July 27th, just a reminder, the CDC updated its recommendations on mask wearing based on the latest data of Delta variant. That included, if you're indoors, vaccinated, unvaccinated, please wear a mask. That was the recommendation from the CDC. The city of Detroit, as far as yesterday, the city recommends, and this is per Denise Fair, city recommends indoor masks for everyone, including those fully vaccinated, to maximize protection from the spread of the Delta variant, and especially because our numbers are low being vaccinated. The next one, this move follows recommendations by the CDC and our Michigan Department of Health. The next thing we're going to talk about is our new mobile-friendly website that we just updated and just got going. I'll give that information. That provides COVID-19 vaccination appointments right from your phone on the go. Detroit Health Department, we're trying to do whatever we can to get people vaccinated. We'll come to you, homebound, we'll schedule you, you can walk up. We have the Good Neighbor program. We have whatever you need. Scheduling on the go to make it available. The next thing we want to talk about, Detroiters, if you have symptoms, you're urged to take a COVID-19 test. I'll give a location where you can take that test. It's a drive up. If you're not driving, you can walk up there, and we can also schedule those as well.
Okay. And Tanea, if I may, because our time is a little bit limited, can I zero in on a couple of questions? And if we could have the rest of the slides in the chat, would be great. So thank you. People need to know where you can go get the test.
Yes.
But we do have a couple of really urgent questions. So back right now, as we said, once people get tested, so what is the timeline? Because we know there is a hotline that people can call that says, I've been exposed, or some of my staff have been exposed to COVID. What's the timeline that the city is saying that they can expect to hear back something that suggests to them what they should do?
So we give that to our tracing department, or, I mean, it kind of depends on the question. So if a person says that they have been exposed, their family's exposed, if they're reporting it as an event where we can trace it, we'll send that to our tracing department.
Mhm.
And that doesn't take very long. They'll get in contact with that facility or wherever it happened. And maybe between 2 and 3 days, because of, it depends on, right now we have quite a few calls like that, because my understanding is, and we get nurses called, I got a couple of calls yesterday about this.
Mhm.
So we're having people that know they're positive, they know they're vaccinated, and unfortunately, they're still going out and having symptoms. What we suggest, and the CDC suggests, if you're positive and vaccinated, if you're not having symptoms, go out, you can, but please wear a mask to protect those that are unvaccinated, that have low immune systems, protect the others. If you do have symptoms, the CDC, and we're saying, stay home, isolate. So it depends on the numbers, but we're unfortunately not getting people to stay home, and that's affecting other people.
Sure it is. Can you help us a little bit, because you're our partner in this work? And one of the roles that we have is to listen to our community and even our own experiences. So you shared that it could be 2 to 3 days, and we know a whole lot of stuff can happen in 2 to 3 days. Is there a plan on the part of the department, or can others help to amplify the importance of this? That when people are calling the department, we've got folks saying, I called a week ago and I haven't heard anything back.
Okay.
So we know that you are our inside person to make sure that the chief health officer knows this, and others. What's the process that we can make sure together that the health department can get the resources it needs to do contact tracing in a much quicker fashion, particularly with the Delta variant? Are there some things that you recommend to us? Because a lot of us have this real concern.
Yes, definitely. We definitely recommend it. I know, and a lot of people want to report as anonymous, and that's great. The business address, if they know anyone who's in charge, because sometimes finding who's in charge can be the most tedious thing. A supervisor, manager, or something like that. Going through that process, them returning a phone call, us going out, making sure that person is there and not having to meet someone else. It's a process. That's the process that can be, make it slower.
Okay. Well, we're almost out of time, but as a partner, we really do want to help run this issue up the flagpole, because
Yes.
even some of the organizations that make up our COVID313 have been experiencing high positivity as people are returning to work.
Yes.
To be expected. But the real concern is that if they're calling the state or calling our city department, they're not hearing back. So please be our warrior on the inside, get this
Yes.
information, because if a CEO, executive director calls and says, I've got these 3 people, I want to report it, and doesn't hear back, we know that's not what you want, and we don't want to either. So help us, and perhaps between now and the next program, if we could get some guidance from the health department about how to resolve this, would be just absolutely phenomenal. Because
I got a quick
too many
answer.
people walking around.
I got a quick answer.
Okay,
Call
go.
the nurses line, 313
Okay.
876 4000. The Detroit Health Department nurses line, option number 3. Talk to us and we'll push it out.
Great. And Tanea, thank you. Great. You know, we all know that everything runs around the nurses, don't we, Registry? So thank you for saying that. No, it's not a secret. Please put that information in the chat. So you heard it, community, as you are calling. If you have not heard back on that general line after a day, maybe a day and a half, because you need to know what to do. Please call Nurse Tanea and some of these other awesome health warriors. Thank you so much. And we're going to switch now to see if we can begin with Dr. Cunningham. Tanea, thank you so much. Thank you. Okay.
Thanks so much for that wonderful information. And yes, we are going to return. Dr. Cunningham, welcome. If you could just go ahead and turn on your camera, that would be great. Welcome to our town hall this week. Miss Latonya is a representative of our community and our parent communities in particular. And so she's going to start off asking you a question or two, and then I'll jump into it after she's finished. Latonya, go for it.
Hello, good afternoon, Dr. Cunningham. And the first question is a big one. And it is, do you think it's safe for children to return to school? What should parents need to know as they are sending their children back to school? What are the top 3 things doctors recommend schools to do to keep the kids safe? What protocols should parents advocate for?
Sure. I think it's important kids go back to school. We know there was a lot of depression. There was a lot of anxiety just from the sense of isolation. They can go to school. What I think is really important, if they're old enough, get them vaccinated. So if they're 12 or older, they can certainly get the Pfizer COVID vaccine. For kids under 12 and unvaccinated children, I think wearing a mask is going to be important. I know the state is leaving that decision up to all the school districts to make on their own, but there's certainly no harm to wearing a mask. I don't care what kind of mask kids get, if it has their favorite TV show, cartoon, anything on it. I think that's important. Good hand hygiene is important. And I think it's going to be important for schools to make sure that if people come to school sick, they're sent home, because the last thing we want is someone to infect lots of other kids, and then these kids get sick and then bring it home to their parents and grandparents who may not do as well.
Okay. The next question is, what should the frequency of testing be in schools? And what should schools do if someone tests positive?
Well, so as far as testing in schools, if people are really wearing masks, there's not really much risk that they're going to be infected. So I can't imagine there's going to be a lot of people willing to get a nose swab every week for testing. So if they're wearing a mask, that's probably not important. If someone is positive for COVID, we're going to have to say you need to stay home for at least 10 days. Don't return until you're feeling better. We worry about exposures in school, but if kids are wearing a mask, that really should prevent the exposures and would hopefully prevent having to have multiple kids in the classroom stay home.
Mhm. Thank you.
Okay.
So, go ahead.
Go ahead, Jamette. I'm sorry.
No, it's quite okay. So I only had 2 questions, but Latonya, so Latonya's out, by the way, educating parents about COVID and how to get resources. So we don't want to hold you up. Go ahead and ask your last question, and then Rajeshri, if we have time, I'll do the next 2. Go ahead, Latonya.
Okay, thank you, Jametta. And again, I apologize. And thank you again, Dr. Cunningham. And my last question is, what would they say to parents who are hesitant about getting their kids vaccinated? Where can you find information to make an informed decision?
Well, first of all, thank you for what you're doing, because this community education is essential. What I have told people is my 2 teenagers are vaccinated. So that tells you I think it's safe. Some good websites. One of the best is American Academy of Pediatrics, which is AAP.org. That's pretty much all the pediatricians of this country. That's our professional association. They have some great resources, as does the CDC. We've given over 350 million doses of COVID vaccines in this country. It's an impressive track record in terms of safety and being effective. And I really do think that that's going to be the way we get out of this pandemic.
Yeah, thank you so much, Latonya.
Thank you.
Keep it up. You're right. Each parent talking to another parent, every family talking to another family. And now while we're talking about our kids getting shots, now our kids can be champions too for the same thing. But one of the things that we know, Dr. Cunningham, has been occurring is this whole concept of what they're calling breakthroughs. Could you talk a little bit about your experience there with Henry Ford? How much if any, are you really seeing breakthroughs of being people who've been vaccinated but have shown up with some symptoms of COVID? Because I'm just wondering, is that getting exaggerated or not? Your thoughts?
Oh, it certainly can happen. I haven't seen great reports of how often it happens. I do look at all of our hospitalized patients, and we have had a handful of people who were vaccinated who wound up in the hospital. All of those people, though, had medical problems where their immune systems were down, either because of cancer or they were taking medications. These, even if you get some breakthrough disease after vaccination, you're not as contagious to other people. And more importantly, these vaccines are almost 100% effective at preventing severe disease. And by severe disease, I mean you need to be admitted to the hospital, go on oxygen therapy, or wind up in our intensive care unit. So yeah, there's some breakthrough disease, but a handful of cases that I'm looking at. The vast majority of people have very mild symptoms for 1 or 2 days if they had the vaccine and get symptoms.
Okay. I'm thinking we may have some questions, but I do have two from the audience, but we have two more questions. So as a pediatrician, and thank you for mentioning the American Academy of Pediatrics, and there's also a Michigan chapter of the American Pediatric Association that people can go to that site as well. But speaking of your colleagues, Dr. Cunningham, what are you seeing in terms of, is there any uptick about the number of young people who are coming in as a result of Delta in particular, both your experience and what you may be hearing from colleagues?
So I will tell you that right now, about 15% of COVID cases across the country are in pediatric patients. Small number get hospitalized, but those that do tend to be really, really sick, almost always unvaccinated. We have not had a lot of pediatric admissions at Henry Ford, but we don't really take sick kids into the hospital very often. We would refer those out to one of the children's hospitals. But yeah, there are some kids who are getting it, absolutely. And I do think that when we restart school, it's going to be a great situation for spreading and more cases, which is why I'm so in favor of masks and vaccines.
So that's like number one, no matter what your state is, vaccinated, unvaccinated, wear a mask indoor all the time. Anything else that you think is critical for parents? Because we've got parents who are going to say, I'm not going to send my child back. I just don't feel comfortable. And as a pediatrician, what do you say to those parents that are opting not to send their kids back because they just simply don't feel safe yet? And what are the 2 or 3 things that parents need to know as their children do go back into the building?
Sure. And, you know, every family has to make the decision that's right for them. So there's no blanket statement. I do worry, though, that when kids are not around their friends, they're being isolated. We know there's been weight gain, anxiety, more suicide, more depression. So you always have to weigh what are the risks and benefits. There are some risks to not going to school. So I'm very grateful my kids will be going to school in person this fall. If you use the mask, I think the risks are pretty low. The vaccines really do make me feel a whole lot better about my kids' safety. And some school districts are doing a great job with virtual education, but they're not all doing virtual education. I do think some of our kids are suffering and losing out on some learning. And, you know, education's so critical for everybody, and I do worry about that.
And we share the same worry, because certainly education is what we do socially, what we do physically, and our very spirit has to be energized in order for our brain to learn. Dr. Cunningham, thank you again so very much. I want to kick it to Rajeshri if we have any questions from the audience. And just lastly, as I'm tagging off, I want to confirm Henry Ford now has required that all personnel, from the janitor to the head of the hospital, has to be vaccinated, correct?
That's correct. We want everyone vaccinated by September the 10th. There are a few exceptions. If you have a medical reason you can't get the vaccine, we would, of course, not force you to get it if it's not safe for you. And people can request religious exemptions if they have a strongly held religious belief. It's not an automatic approval. There's a process that looks at it. We felt we had to, since we're saying get the vaccine, we wanted to be leaders who said we're going to put our money where our mouth is. And the vast majority of our leaders were all vaccinated in December and January.
Okay. So Dr. Cunningham, let me then again, thank you. Do we have any questions from the audience, Christine or Rajeshri?
A little bit of background noise. We've got Play-Doh going on, Play-Doh playing going on right now. And there's a few things that are getting blown up in our imagination. So there, Dr. Cunningham, I think you did such an excellent job. I think as a parent, and I'm partly because there's a lot going on around me, but I just wanted to hear again, what are the, should we have concerns as parents sending our kids back face to face in lieu of the Delta variant?
There's going to be more variants coming down there. We can't put our life on hold for years, and I really truly believe education is such an investment in ourselves and our children in the future. And that's why if parents are concerned, I am not minimizing their concerns, but that mask is going to make you a whole lot safer, as is the vaccine. So if you're really worried, those are two things you can do that would certainly help. And some schools will let your kids bring some hand gel with them. I have the little small tiny containers of alcohol hand gel in my kids' backpacks, and I like knowing they can clean their hands really easily whenever they want.
Absolutely. I think that's really all the questions that we have. You did such a good job, Dr. Cunningham. We're really lucky to have you on again today.
Thank you for inviting me. I hope you all stay healthy and well and try and enjoy some of this beautiful weather we still have.
Yeah,
yes, absolutely. I hope you are enjoying it as well.
I am. I'm going to take the dog for a walk soon.
There you go. Okay, wonderful. Thank you. Christine, I'm passing the baton to you for our next segment. Thank you.
Okay, so our next guest, and again, I am so sorry for the background noise. We'd like to welcome Tony Paris. Tony is from the Sugar Law Center, and he is joining us today to talk about unemployment benefits, but then also what we can expect as employees and employers as it relates to COVID mandates, such as your employer might be mandating you right now to get the vaccine, or maybe they're not, and you're concerned about that. So welcome, Tony. We are really lucky to have you here today.
Thanks, Christine, and thanks to everybody for having me.
Great. So we have a couple of questions, Tony, to start us off. And I have so many tabs open that I am looking for the questions. So the first question that we have, and we know that you've answered this before for us, but just to kick us off with an easy one, are businesses and organizations allowed to mandate their employees be vaccinated?
Yeah, the general rule for that question is that they can. The doctor mentioned there are a couple narrow exceptions to that, but generally employers can require vaccination. We're especially seeing that in the healthcare field and in certain other types of jobs that really require either a lot of close contact with individuals or other types of, I guess, sick or otherwise potentially ill individuals. The two exceptions that are really narrow and often will require some type of paperwork or filing with your employer are whether or not there is a potential disability or condition that requiring a vaccination would jeopardize or otherwise put at further risk. And that's what we're seeing with that is it's pretty rare. We haven't seen a lot of disability accommodations where an individual is able to say that my medical professional or anybody, my doctor is saying that if I get this vaccine, it's not good for me for whatever reason. The disability needs to be something that limits your major life functions. So I always advise folks sitting, standing, and other types of conditions. And the accommodation, it has to be reasonable. So if you're asking to be able to work without being vaccinated, if the employer grants an accommodation, for example, they might require you then to work remotely or wear a mask or otherwise be tested regularly. All of those things are possible for folks who believe they have a disability where requiring vaccination would be discriminatory. The other even narrower exception to that is a bona fide held religious belief. The doctor mentioned that as well. This would kind of happen if something about an ongoing religious practice or something that you show is bona fide, that it actually is a legitimate religion that you practice that has its doctrine or its understanding, and that a vaccination would run against it. Why I say that's probably a narrower exception is because there's a Supreme Court case out there that struck down religious exemptions for schools, where a lot of folks had brought a case saying schools can't require us to be vaccinated for other things, smallpox, all the vaccinations we all need to go into schools. And the Supreme Court said, no, actually they can, public schools can do that. So I believe there will be a very similar interpretation with the COVID vaccine that makes the religious doctrine or the religious exemption less applicable.
So if I'm hearing you right, Tony, it doesn't sound like the same, because we do know that there are waivers for vaccines that are not as new as COVID, like the polio vaccine and some of those that are required to go into school. But it sounds like they're not making those same exceptions for the COVID vaccine. Am I understanding that correctly?
It would probably be the same type of paperwork that you'd fill out if the school, for example, provided that for polio or smallpox or whatever. But the cases have not come up through the courts yet high enough. So we're only relying on that other one, which says that in general schools can mandate that. You know, what we've been kind of telling both employers and employees is that getting the knowledge out there is the most important thing. That's why things like this town hall is so important. And also to kind of incentivize, the employer should incentivize employees for getting vaccination. A lot of folks, even if it's not tied to a disability or religious reason, they're worried about missing work. They're worried about whether they're going to have to need a day to recover if the second shot, like some folks experience, kind of has a little bit of side effects. And if employers are able to incentivize that, they would probably have to deal with a lot less of the paperwork and a lot less of the other potential problems. We've seen gift cards offered. We've seen paid time off to go get vaccinated. We've seen employers bring vaccination stations to the office or to the job site. All those are real good things to kind of help employees have a smooth way to have access to information and to have access to the vaccine itself.
Tony, you talked a little bit about accommodations. So just to go a little deeper on that, what accommodations is there for an employer that is not mandating vaccinations and you don't want to return to work because they're not requiring vaccination? So almost the reverse.
Yeah, that's a really good question. And I can look at that question through not only the lens of whether you can keep your job if they're requiring you to return, but also through the lens of unemployment insurance benefits, which is going to be a hot topic. It's been a hot topic since the pandemic began. It really showed the need for expanded benefits. But more importantly, I think it's a hot topic because on September 4th, the extended benefits are set to expire. And all indications kind of look like, unfortunately, they're not going to be expanded for additional weeks. It doesn't necessarily mean everybody is going to be shut off of unemployment benefits. It still provides for 20 weeks or more for folks who still have weeks remaining. But for the folks who've been on it since most of the pandemic, this probably means that this will be their last few weeks of unemployment insurance benefits. Generally, the accommodation of returning to work and whether or not the employer can terminate you or not is really going to look, you're going to look strictly through the lens of the Family Medical Leave Act, or FMLA. FMLA, for it even to apply, you have to have over 50 people employed. The small employers are really not going to have to deal with that as much. You are allowed to total the different employees at various sites as long as they're within 75 miles of each other. So if your job has a couple of different offices, you can add those together to see if you can get to that threshold. More importantly, what disqualifies many people is that you have to have been employed with them for a year or more full time, or a certain number of hours that totals to about a year full time. If none of those things apply, the FMLA, which provides up to 12 weeks unpaid leave for a serious medical condition or illness for you or a family member, doesn't even apply. And so if you don't have those thresholds, really the employer can require you to come back in. And if you say no, they can terminate you. If FMLA does apply, you still have to prove it's a serious medical condition. Not that you are worried about potentially being sick, but that you are currently suffering from the medical condition. Usually, in interpreting that, it requires some type of incapacitation or directly under doctor's care at the time. And so that's a real stretch. Now, if an employer, for example, accommodates certain things and lets them stay home and doesn't accommodate you for this, then we can look at whether or not terminating you could be illegal and discriminatory if they're making those decisions based on race or age or gender or national origin or religion or disability. Those types of favoritism in America are illegal, whether you're at will or not. And so if an employer is generally sticking to a rule and enforcing it equally across the board that says you have to come into work, and we're requiring that, more often than not, they're going to be allowed to do that. And then if we look at how it applies to unemployment insurance, and many of the folks out there might be worried about, well, do I have to go back in? I've been off and on unemployment, or do I have to accept another offer of work elsewhere when I have these worries about COVID and everything? Then we look to whether or not it's suitable. The work offer is quote unquote suitable. That's what the law kind of looks to. There's multiple factors to determine whether a job offer or an offer to return to work is suitable. But the main one that will focus for the topics we're discussing today are health and safety concerns. And so if for whatever reason, an employee believes that social distance guidelines aren't being enforced, or vaccinations aren't being required, or masks aren't being required, or cleanliness or sanitizer isn't being provided, and that it's a direct job site where you're dealing with the public a lot, or in close proximity with one another. If they're able to demonstrate that, and that it's a reasonable worry or a reasonable hesitancy, it's very possible that you could still stay on unemployment and refuse an offer to return to work. But that suitability factors change over time, because the reasonableness of whether or not the danger is out there has changed over the course of the pandemic. It changes with more vaccinations. It changes with more science and medical opinions that we're receiving. Or sooner or later, I can imagine, very soon, if not already, it won't be reasonable anymore to either assume that vaccinated folks would be at a heightened risk, or if your employer did require vaccinations, for example, that your workplace would be unsafe. And then I think employees might have some trouble maintaining their unemployment insurance eligibility.
So I think, Tony, I think I heard you say, and I just want to clarify, if the company that you're working for requires vaccination to return to work and you're hesitant, could you still qualify for unemployment compensation? And it sounds like at this point, no,
It's getting harder and harder. Let's
to
put
prove
it that way.
that because
Yeah.
of the reasonability, what you just described about things being reasonable.
Yeah, now an offer to return with vaccinations on the increase, and especially employers who require vaccinations, because it's shown to not only help spread the disease, but help, or help, prevent the spread of the disease.
I was just gonna say, not help spread.
But more importantly, it's now going to be, the health and safety concerns that you're worried about, or an employee might be worried about, have been reduced. And so I can imagine, early in the pandemic, when people were afraid of going into the service industry and nobody was vaccinated, and some employers weren't requiring masks, and you're dealing with the customers and all that. A lot of those cases we were able to win, that you didn't have to go back to work yet, especially if you're immunocompromised or,
Right.
or anything like that. And we're watching that change as we speak.
And you said that that you didn't think that there was going to be an extension of the pandemic benefits, but is there any other additional information on the status of pandemic benefits for certain businesses and individuals?
Yeah, so the federal laws that allowed for the ongoing expansions that were passed a couple times during the course of the pandemic are set to expire on September 4th. Not only the amount of weeks might end there, but remember there's additional $300 per week for folks. Unprecedented amount of benefits added on top of your state benefits, which normally max out at $362 a week. So this was an extra $300. That they're both set to expire on September 4th. And with Congress not being in session and really a lot of our folks being vaccinated and businesses chomping at the bit to get open again, it doesn't look like that's going to be extended. Now, that doesn't mean that everybody is going to be not have any more weeks. The normal law provides for 20 weeks of unemployment insurance benefits. I believe Governor Whitmer extended that to 26 weeks by executive order. So if somebody just recently, let's say within the past half year or so, opened a claim and weren't on it before, they may still have some weeks left. They won't get the extra 300 anymore, but they would get their normal unemployment insurance benefits during that time period.
So you just talked about some of what has been extended and what the timeline is, and that it's the current benefits are set to expire in September, both the addition, the $300 in addition, but that Michigan, it has 26 weeks. So I think we've covered those questions that we had. What are permissible reasons to not seek work and still receive unemployment?
That's a good question too, because as of June 1st of this past summer, the seeking work requirement was put back into place. From the majority of the pandemic, you weren't required to seek work and to go through the general job search requirements that are normally required to get unemployment insurance benefits. There is a waiver though, and I'm not sure how long the waiver is going to be to last. That's put in by our state government, but it's still there now, where if any of your members are familiar with the unemployment insurance system and on their MyWAM account, under claimant services, it's the last link, and it's a waiver. It's a seeking work waiver, and it's a fairly easy document to fill out. You can do it right there on your MyWAM account, and it deals primarily with the children are home from school and doing remote learning, and you don't have customary childcare. You are immunocompromised or have in quarantine for COVID or have COVID issues. Pretty much, they just kind of took Governor Whitmer's expansions to unemployment, the executive order, and still allowed them to be part of the waiver. My folks use it a lot. When they apply, it doesn't require a lot of heavy lifting, so it's always available. I just know for how long, and then after that goes away, all of the regular, putting a putting a resume up. I'm sure the requirement to go to a Michigan Works office and upload a resume in person will be re-implemented soon if it not already has. And then you just have to show that you're looking for work in the meantime. I will say really quick, in addition to folks being kind of potentially cut off on September 4th, there's quite the thing going on in the state of Michigan right now where folks who are on PUA benefits, this isn't just regular unemployment through the state mechanism, but folks who are on the federal expansion, mostly meant for contractors, self-employed, 1099 gig employees, and other types of stuff. Well, 600,000 or somewhere around there of these folks are being asked to reaffirm or reattest or resubmit their certifications. Michigan made a mistake or wrote the questions worded a little wrong. And I was under the impression at first that this was only if they wanted to stay on benefits. So many of my clients who've been off of unemployment insurance benefits, I at first advised not to reattest or not to worry about it. Well, we now learn that it's retroactive and that this could potentially make previous benefits ineligible unless folks go back in and reaffirm or requalify. And that's a pain. You have to answer the same questions again, sometimes multiple screens of them, just with the better wording. But if you don't do it, there's a chance that they're going to ask for that money back. And nobody wants to deal with that. So it's better, to nip it in the bud beforehand and check your MyWAM, see if it's asking you to requalify, answer those questions again. If you have any questions or comments, folks can always call the Sugar Law Center. And I'll put my information in the chat for folks, my email and our phone number, because we are dealing with a lot of the requalification problems. We've seen some assurances from the Governor Whitmer's office that these were mistakes, that folks might not have to pay it back, or that she's trying to do it, but we just can't trust the system at this point. And there will be much bigger headache for folks who might have to protest decisions against them and go up to hearings and deal with bills, than maybe just answering the questions as best as they can.
So Tony, if I'm hearing you right, those people that have gotten some sort of notice that they need to reaffirm the questions that they answered for unemployment, the unemployment benefits that they got or compensation, they need to, whether they're done with unemployment, whether they're done with unemployment or not, they should answer those questions. And if they need help, you are dropping your information in the chat right now.
Yep, absolutely.
Okay.
And it's a little confusing. Like if folks do it and they doesn't let them answer the next screen of a question, because you have to go back and certify for. I saw one that was like 26 certifications, and my folks had to answer those questions. And then when we hit submit together, it wouldn't allow us to go to the next screen. There's a tiny little red X in the upper left-hand corner that you have to go and actually click to go to the next screen up with the arrows near that tiny red X. I couldn't figure it out until we called somebody at the Unemployment Insurance Agency on speakerphone. So really, it's not a user-friendly system, but it still is better to try to get that, to be on the front of that, as opposed to dealing with a restitution issue or collection issue later on.
And you named a couple of different types of folks or categories of folks that would need to do this. Is there anyone else that's being asked to repay their unemployment?
Yeah, there's many. The agency is so overwhelmed from the pandemic with and without enough staff to handle it that we're seeing a lot of folks, although month to year later, now finally get their denials. Where an employer is claiming that you quit and you didn't have good enough cause, where they might have refused suitable work, like what we were talking about. The agency has up to 3 years to issue these decisions. So we are seeing you're not necessarily always out of the woods just because you're not on unemployment anymore. Folks should still pay attention to their MyWAM, to their email, to their mail to get any of these denials, because there was quite the lag in time. And all of the other disqualifying reasons, not just COVID related, but anything else about you're fired for cause, you quit without cause, or anything like that, could still pop up for folks, and they could be found to be ineligible and have to repay back that money unless they are protesting those decisions. We call them determinations or redeterminations. And if you see any of those out there, you don't need a lawyer to protest those. You just, MyWEM is the easiest way, as opposed to mailing things. The agency's not even getting their hard copy mail, we've been told. That really what you do is you go on your MyWEM, you read the determination carefully. If it's against you, says you're ineligible or anything, you protest it right there. You don't even need to write a lot to have it staged to the next level. I disagree with this and requested redetermination, or I disagree with this redetermination and requested hearing. Very simple, short and sweet, but you only have 30 days to do that. If you don't do that within 30 days, now there's a whole nother problem for us to be able to prove that you were entitled to those benefits to begin with. And remember the 3-year thing. A lot of times the agency is pretty bad at, long after somebody's off unemployment and thinks they don't have to worry about it anymore, they get a letter saying you were never entitled to begin with. And it's not fair, but it's something that we have to do to prevent tens of thousands of dollars in some folks from being collected against them.
Tony, thank you so much. Please, if you'll drop your information in the chat, we'd really appreciate it. Also, if you have anything in writing, if you have it in Spanish, if you could send it to us. If you don't have it, if you could send anything that you have in writing about what we just discussed, if you can send it over to Molly, we'll get it translated for our Spanish speaking folks. We appreciate you being here with us. Thank you so much. It is that time. We're 1 minute over. And I just have a few more announcements. Thank you so much, Tony. If you're behind in your rent, mortgage, or utility bills, you can join a virtual discussion of programs available to provide financial assistance to those in need next Wednesday, August 18th at 5 p.m. It is available on Detroit Public Television's Facebook page. You can register to join the Zoom at michigan.gov/MSHDA events. And we're going to drop that in the chat. This is presented by the Michigan State Housing Development Authority, DTE Energy, and Detroit Public TV. The event will feature experts who will, and you'll walk away knowing the steps to secure this really valuable funding. Again, there is help for you if you're behind on your rent, your mortgage, your utility bills, please take advantage of that. DPN is having a back to school event, and that is going to be on the 20th. So we're going to drop that information in the chat. Today, if you want a vaccine or information about healthcare at our park at 8300 Longworth in Southwest Detroit, we are going to have Chaz and a mobile vaccine unit out there to offer vaccines, and Chaz will be there to offer health information. We'd love to see you. Starts at 3:30. They'll be there till 5:30. If you're lucky, also the ice cream man will be there as well, if you get there early enough. So this was a great show today. Thank you all. Thank you to our guests. Y'all have a great rest of the day and a great weekend. Remember to stay healthy, stay strong, stay informed. We'll see y'all later.